My name is Ranjana Chauhan, Assistant Professor in Symbiosis College of Nursing, Symbiosis International University. My topic is in occupational health nursing. Occupational health should aim at the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. The prevention among workers of departures from health caused by their working conditions. The protection of workers in their employment from risks resulting from factors adverse to the health. The one more definition is the placing and maintenance of the worker in an occupational environment adapted to his physiological and psychological equipment. And to summarize the adaptation of work to man and of each man to his job. This definition is given by the Joint ILO WHO Committee of Occupational Health. Thank you. The objectives are there, the maintenance and promotion of workers' health and working capacity. The second one, the improvement of working environment and work to become conducive to safety and health. The development of work organizations and working cultures in a direction which supports health and safety at work and also promotes a positive social climate and smooth cooperation and may enhance productivity of the undertaking. There are hazards are there in the occupations, physical hazards, chemical hazards, biological hazards, mechanical hazards, and psychological hazards. In physical hazards, heat, cold, noise, light, vibration, ultraviolet radiation, ionizing radiations. Because of this, these are the things the physical hazards may happen. Due to heat, burn, heat exhaustion, heat stroke, heat cramps, increased fatigue, enhanced accident rates. Because of the cold, chill blends, erythrocyanosis, immersion pool, frostbites as a result of cutaneous vasoconstriction, general hypothermia can happen. Because of the light, eye strain, headache, eye pain, lacrimation, congestion around the cornea, eye fatigue. Because of the noise, the auditory effects are there. The temporary or permanent hearing loss. The auditory effects are nervousness, fatigue, decreased efficiency, hollowness. Because of the vibration, it may also produce injuries of the joints of the hands, elbows, and shoulders. Because of the UV radiations, conjunctivitis and keratitis may happen. Because of the ionizing radiations, cancer, leukemia, sterility, ulceration, and extreme cases death may occur. The International Commission of Radiological Protection has set the maximum permissible level of occupational exposure at 5 mg per year to the whole body. Chemical hazards, it may happen because of the local action, ingestion, and inhalation. Due to the local action, the dermatitis, eczema, ulcer, cancer, primary irritant action. Because of the inhalation, dust, gases, metals, and their compounds. Chemical hazards, because of the dust, are finely divided solid particles with size ranging from zero point 0.1 to 150 micron. The dust particles larger than 10 microns settle down from the air rapidly. These are the size of the dust may enter in the body. The classification of dust, the inorganic and organic dust, soluble and insoluble dust. And because of the gases, the simple gas, then anesthetic gases. The chemical hazards are the metals and their compounds, lead, antimony, arsenic, cadmium, cobalt. Because of the ingestion, the occupational diseases may also result from the ingestion of the chemical substances such as lead, mercury, arsenic, zinc, chromium, cadmium, phosphorus, etc. The biological hazards are brucellosis, leptospirosis, anthrax, tetanus, encephalitis, fungal infections. The biological hazards, it happens because of the viruses, bacteria, parasites, and fungi. The mechanical hazards because of the machineries we work. Psychological hazards due to the frustration, lack of the job satisfaction, insecurity, poor living relations. Psychological hazards affects linked to psychological and behavioral changes, psychometric behavior. The occupational diseases are the pneumoconiasis is very common of the patients. Again, the pneumoconiasis, pseudocosis, anthracosis, bacillus, bagosis, asbestosis, palmer's. The silicosis is caused by the silicon, free silica. Anthracosis, it may be the coal miners. Bacillus, it may be the cotton fibers. Bagosis, it may be the inhalation of the sugarcane dust. The symptoms are the breathlessness, cough, hemoptysis, slight fever. Bagosis, Bagosis is the preventive measures are the dust control, personal protection, medical control, baggage control. Asbestosis, it is of two types, serpentine or crystalloid variety. Clinically, the disease is characterized by the dyspnea, clubbing of fingers, cardiac distress, and cyanosis. The sputum shows the asbestos bodies. An X-ray of the chest shows the ground glass appearance in the lower two-thirds of the lung fields. The preventive measures are there: use of safer types of asbestos, substitution of other insulants, glass fibers, mineral wool, calcium silicates. The egress dust control is very important. Periodic examination of workers for the X-ray and continuing research. Farmer's lung. Farmer's lungs is due to the inhalation of the moldy hair or grain dust. Lead poisoning. Mode of absorptions are inhalation, ingestion, skin. Lead poisoning, the clinical features are there: constipation, loss of appetite, blue line on the gums, stippling of red cells, anemia, wrist drop, foot drop. The toxic effect of the organic lead compounds are mostly on the central nervous system, are insomnia, headache, mental confusion, and delirium. It happens on the adults and children. The occupational cancer is very common. It is a skin cancer, lung cancer, bladder cancer, leukemia. The occupational cancers, the control measures are very important. The elimination or control of industrial carcinogens. Medical examination is very important. Inspection of the factories. Notification, licensing of establishment, personal hygiene measures, education of workers and management research. Occupational dermatitis happen because of the physical, chemical, biological, and plant products. The prevention of the dermatitis are pre-selection, protection, personal hygiene, and periodic inspection. Radiation hazard, the shielding of workers, monitoring the employees, protective clothing, adequate ventilation, replacement and periodic examination, avoidance of pregnant women to work. Sickness absenteeism causes are the economic, social, medical, non-occupational causes are there. The prevention are the good factory management and practices, adequate replacement examination, good human relations, application of ergonomics. Then accident causes are the human factors, physical, physiological, psychological, and environmental factors are there. How to prevent the accident? Adequate replacement examination, adequate job training, continuing education, ensure safe working conditions, establishing safety department in the organization under a competent safety engineer, periodic survey for finding out hazards, and careful reporting. These are the major health problems due to industrialization. These are the common health problems happens due to the industrialization are environmental sanitation problem, communicable diseases, food sanitation, mental health, accidents and social problems, morbidity and mortality. The measures has to take the nutrition, communicable disease control, mental health, environmental sanitation, measures for women and children, health education and family planning. These are the measures has to take for the promotion of the workers. Thank you so much. What are the we are discuss about all the occupational hazards, occupational definition, and objectives in this PPT. Thanks a lot.